Hi, I'm Ali. I'm one of the physios from treatmyachilles.com. This is the third video in our series on Sever's disease. If you have children that are suffering with any kind of heel pain, one of the most common causes is Sever's disease, and we are doing a series on running through what can cause it and what you can do about it in more detail. So if you haven't seen the other videos in the series, please take a look. This third session is going to be talking about stretching and what stretching can be useful and what is not so useful in the early days for Sever's problems. We are treatmyachilles.com, which is an online platform for physiotherapy, treatment and assessment for any type of Achilles injuries. If you are interested in booking an appointment or finding out a bit more about our service, please have a look in the links below. So this video is going to be focusing on stretching and stretching related to Sever's disease or heel pain in young people and teenagers. Please have a look back at the videos beforehand, which outline a lot more information about what Sever's is and what treatments are available. Stretching is one small component to the treatments and things that you can do to help manage this problem. They are not the be-all and end-all, and in some cases people don't need to do them at all. They would be part of an assessment by a practitioner, which we can do online. So please make sure your child has a tailor-made program for them and reached out to a practitioner if you are concerned at all for any symptoms that your child are getting. We're going to run through some stretches that are the more likely ones that we would give people and run through why we would give them. We're also going to be talking about this as part of a bigger package. So that bigger package would, when we're looking at just exercises as one component of that package, the rest could be about pain relief or how they're moving and what they're doing, or things that you could use in shoes to help, or tape for that matter, to help with symptoms and what's going on. So if we're looking in the exercise bracket, there are different types of exercises. There's our mobility and stretching exercises. There's looking at whether we've got any neural component that we've touched on in some of the earlier videos. And then there's looking at control, how that person's moving and what they're doing. And then it's also looking at strength. So there are many components to the exercise. One little bit we're going to zoom in here is stretching. So stretching for a Sever's problem. Well, the main muscle group that contributes to it are our calf muscles. Our calf muscles are our gastrocnemius and our soleus muscles, and they run down the back of our leg to form our Achilles tendon, which then attaches into the base of the heel. And it's the base of the heel, that calcaneus area, that tends to be irritated and not very comfortable for people with Sever's problems. When we have that, we've talked before about it being a traction apophysitis, so we're talking about it being where there is forces going through the Achilles tendon at the back of the heel where it attaches into that calcaneus. That can cause irritation or inflammation around that area where it feels a bit angry and not very happy, especially right at the early days when you're seeking treatment out. Or it might be something that's stopping you from doing the activities that you want to do because the pain level and irritation is quite high. If we have a highly irritable or quite symptomatic area around that heel, it's probably not wise to do calf stretches at this present moment in time. I'm saying the words probably because we can make this into a logical sense. We can apply clinical reasoning as to why this might not be okay. But there isn't any evidence base out there at the moment. No one's done the research paper on this. So the clinical reasoning, the logical explanation as to why I would leave this to one side in a really acute, irritable situation is that where the Achilles comes down and attaches onto the heel, if we were to stretch it, we're putting a little bit more compression through that area. So what I mean by that is where your Achilles touches that and inserts into that calcaneus, if we go into a stretch position or a dorsiflexed position of the foot where the toes come back towards the shin, what we're doing is bringing that Achilles tendon closer to the bone and the insertion. So anything that's a bit irritated there is a bit like pressing on a bruise. It also may be uncomfortable because it's putting a bit more of a traction force through this. And as we've discussed, this is a traction apophysitis, where children are growing, their muscles are not growing at the same time as their bones, and therefore those muscles can be a little bit tighter, causing more pulling or traction onto the back of that heel. Well, if I were then to do some stretches that cause more of that pulling sensation, again, I could be irritating something. So this isn't to say that we would never give calf stretches. We could and we might in certain circumstances, depending on the person in front of us, but we certainly would try and avoid those during that first initial acute phase and maybe bring those in a little bit later. So please don't take that as to be your child must never bring their feet back towards you. They must never do any positions where it goes into stretching. That's not the case. They're not damaging anything if they're doing that. They're not causing this to be a problem or something that's going to be causing any damage to the Achilles or to the calf itself or into that heel bone. But what it could be is just prolonging things and making it a bit more irritable. So if they need to pull their feet back towards them, you don't want them getting stiff, you don't want them losing that movement. If they're doing that, putting their shoes and socks on, or they're doing certain things where they're playing with their friends, please don't make it into a thing where they shouldn't be doing that movement. We're talking more about sustained stretches into that position or activities where they might be doing repetitive movements into that position. So lots and lots of stretches in a row. So what can you do for the calf while this is being quite irritable? Well, that's where you could come on with some self-massage, or you could have a go at massaging your own child's calf, or indeed going to see a practitioner who can help with this. Another option is dry needling. There are some articles that we have on this, and there's links to those below. So we're going to look at some typical stretches. If we were to look at the posterior chain of our body, that includes our bottom muscles, our glutes, our hamstrings at the back of our thigh, and our calf. So we're going to be looking at typical stretches for that whole posterior chain. One option for our bottom muscles, for our glute muscles, is something that your child's probably done in PE or done in their sporting sessions. So they would bend their legs up, cross one leg over the other, and let that knee drop out. Reach in between your thighs to the back of this thigh, and then pull in to the point where they feel a stretch. And they should feel a stretch in the side they've crossed over in their bottom muscle. None of this should be painful. Nothing should be bringing on any symptoms whatsoever anywhere in their body, but it should feel like a stretch sensation. If your child is getting any pain or they're not able to get their leg into this position, do not do this stretch. Please go and seek some medical advice and opinions on the best one for your child. If they were to then compare that to the other side, you could see whether you feel like one side feels tighter than the other, or they look like they physically can't move it as far as the other. And this is part of what our assessment would be as to whether that would be appropriate for your child or not. Alternatives to this one can be in a seated position with one leg out in front and the other one crossed over, where your foot is on the floor. You bring that knee to your chest and twist round, and again you should feel it in this glute here. Some people prefer one, some people prefer the other, some are more comfortable, some may find the other one less comfortable. Sometimes it's easier to sit than it is to lie. These are just a couple of options doing the same thing. For the back of our leg or our hamstring, a really nice option in lying is to bring your leg in, keep the other one straight, hold on to the back of the thigh. Important thing to note, because we're not getting the calf involved here, but also in that other stretch we've just done, your foot stays relaxed. So it's not pulled back, it's not pointed straight, it's just in a nice relaxed floppy position. At this point, you can straighten your leg up until you feel a pull down the back of your leg, typically in this position here. And again, you hold nice and comfortably. We're looking to hold all of these stretches for 30 to 40 seconds. So we get a stretch reflex and that muscle then gives and get a little bit longer. Less than 30 to 40 seconds, not really worthwhile doing. And you would probably do a couple to 3 on each side of each type. These can be done for times where your child might be resting, watching the television, might be lying in bed before they go to sleep, could be done for warm-ups or cool-downs for activity. Again, you could look one side compared to the other and see how you go. An alternative in standing, particularly if they're about to play sports and activities, is to put one leg in front, that leg is straight, the back leg is bent, and you lean backwards and you can feel that pull down the back here. Again, the foot can be relaxed. Sometimes this can be uncomfortable because you're putting a bit of pressure on the heel. If that's the case, that's not an option for your child at this moment. Gentle calf stretches, once you have the clearance from a clinician to do these, can be your typical runner's stretch that you might have seen before. So again, your back leg is straight, your front leg is bent, both feet are facing forwards, and you lean forwards till you feel a stretch in the back of that calf. For the other calf muscle, the soleus, you could bring it slightly closer together, both feet facing forwards, and you bend both knees. Typically feel that slightly lower than the other. Again, your child may not like these stretches. They may not be the best ones for them. There might be other options. In the short term, an alternative for a calf stretch, particularly if we're starting to be a bit more gentle. After, again, you've had the all cleared from the clinician, you might put a band, or it could be a scarf, pair of trousers, a belt around a foot, and then you pull back and hold. And again, you could grade how far they're pulling back to any kind of pain or symptoms. This needs to be comfortable. And again, it should be just a pull in the back of that calf muscle. Again, all these stretches are 30 to 40 seconds. So finally, it is always worth seeing a practitioner or a physiotherapist, and we can do this online, to have a look at what is the most appropriate stretches for your child, whether they can do them, whether they find them comfortable, how often to do them, and which muscle groups are relevant. We may leave the calf stretches well alone until things have calmed down a little bit and then return to that. And this is part of the rest of the treatment that's out there, including the other types of exercises, which could be neuromobilization glides, strength, and so on. And that has been detailed more in our videos in this series.